When I was 13, I helped my mom recover after her brain surgery. She had to relearn how to feed herself, how to talk, and how to walk again. I can still feel the fear and anxiety I experienced. There is nothing worse than watching someone you love suffer and not knowing what to do or how to help. This is Anup. I met him 2 days after his open heart surgery in Bangalore, India. I sat with his mom and dad when it was time for them to go home, and a nurse came in and gave them a 5-minute lecture on everything they needed to know to keep their baby healthy and safe. The medications he'd have to take, warning signs to look out for, changes to his diet, all of this and more in 5 minutes. Anup's mom and dad couldn't read or write. They lived over 100 miles from the nearest hospital, and they left overwhelmed and terrified. Now, none of these things were particularly complicated. They just hadn't been presented to his parents in a way that they could understand. And it was at no fault to the nurse. Wards in India are overcrowded. Doctors and nurses simply don't have the time to spend more than 5 minutes with patients on their aftercare. What's interesting is when you walk into a waiting room in India, you find this. It's very common for families to actually move to the hospital and live there throughout the duration of their loved one's stay. So if you take a step back, you have unoccupied family, you have overburdened staff, and you have a lot of things and tasks that need to get done on the ward, but the staff simply don't have time to do them. So we thought, what if you took this compassionate, motivated, untapped resource, the family member, and you taught them how to provide care? What if we could turn hospital waiting rooms into classrooms and take people out of the hallway and next to the bedside of their patient? What if we could put families at the center of the healthcare team? At Nora Health, we've developed a curriculum where we teach families things like hygiene and how to monitor medications, to warning signs to look out for. None of these things are particularly complicated, but it turns out how to teach people and when to teach people is. We gather people in the wards, and we use interactive videos so that literacy and educational background are not a barrier to experiencing the program. People like to see a trusted professional, and then they like culturally relevant characters that repeat, and they even like a bit of entertainment. Then we get people practicing the skills. So instead of a 5-minute overview of what you're going to be expected to do when you go home, you have 15 hours to practice. So behaviors like washing your hands before you touch a wound start to stick, and you go home with a plan. We really love data, and we needed to know the impact of our work. So we've measured that we're reducing anxiety for both the patient and the caregiver. We're improving confidence, and we're extending the network of care. So for every person we train, they go on to train between 1 and 3 additional people in their home or in their community. But we didn't expect this. A team of researchers from Stanford University conducted a study on our program, and it revealed a 71% reduction in post-surgical complications. These are things like serious infections, pneumonia, things that lead to rehospitalization and sometimes death. We've been in India for just under 2 years. We've trained 25,000 family members, and we're in 20 hospitals. And because of the sheer volume of people in and out of the places where we do our trainings, we'll train 1 million people by the end of 2018. But the thing is, even at 1 million people trained and with this impact, we're just scratching the surface. As you know, there are over 1.2 billion people in India alone. So my colleagues and I are constantly asking ourselves, how can we spread this model? How can we make this the new normal? While it wasn't easy to develop, it turns out this is a pretty simple solution to a big problem. And better yet, it's something others can do. And that's the point. We exist to make this the new standard of care and to transform healthcare from a scary and sterile experience into something full of compassion and love. Thank you.
Thank you for being here.